Healthy eating is all about balance. 1/3 of your food should be fruit and vegetables, 1/3 starchy foods such as bread, cereal, rice, pasta and potatoes. The rest of your food should make up the final third. You can ask for dietary advice at any stage of your treatment here, or you can ask your general practitioner to arrange for your community dietitian to keep in touch with you once you return home. Medication. The nurse discharging you will give you a supply of tablets which should last at least 2 weeks. This will give you time to get your prescription to your GP ready for your repeat prescription. The medication you will now be taking will almost certainly be different to what you took before your operation. Therefore, it is safer if you dispose of any previous drugs that you still have at home. They should be returned to your pharmacist for safe disposal. Your GP will be sent a letter explaining what operation you have had, the medication you are now on taking, and that you have returned home. You will also be given a copy of this letter. You should keep an up-to-date list of your tablets with you at all times, and if you're taking warfarin, then keep your dosage booklet with you. There are different groups of drugs used in the treatment of heart disease. Below are listed just a few of them. Antiplatelets. These make the blood cells less sticky, which helps to reduce the chance of a blood clot forming inside your arteries. This helps to lower the risk of further heart attack. Aspirin should always be taken with food. Clopidogrel. This can be taken either instead of aspirin or as well as. ACE inhibitors. These reduce the amount of work the heart has to do by widening the blood vessels. They can also help to lessen the effect of the damage caused by a heart attack. They can also be used to treat high blood pressure and heart failure. Ramipril, perindopril, captopril, lisinopril, and enalapril. Angiotensin, or antagonists. These act in a similar way to ACE inhibitors. They also lower blood pressure, and they can also be used as an alternative to ACE inhibitors. Losartan, valsartan, arbesartan. Lipid-lowering drugs. These reduce the amount of cholesterol in your blood, which helps to reduce further build-up of fatty deposits in the coronary arteries. These should be used in conjunction with a low-fat diet. Simvastatin, pravastatin, and atorvastatin. Diuretics. These are also known as water tablets. They increase the amount of urine produced by your kidneys, which in turn removes excess fluid from the body. This helps to reduce the strain on your heart. Some diuretics are used to lower high blood pressure. Furosemide, coamylofruse, bendrofluoride, bumetanide, spironolactone. Anticoagulant. Warfarin is used to thin the blood where there is possibility of blood clot formation or evidence that a blood clot may be present. The dose may vary according to the thickness or thinness of your blood, and this is why you need to keep your appointment regularly at your local hospital or your GP to have your blood checked. Antiarrhythmic, to help control fast or irregular heartbeats. Digoxin, amiodarone, sotalol. Wounds. Depending on how long you're in hospital, you may have your stitches removed before you leave, or you'll be given a number to contact your nearest walk-in centre to make an appointment to have them removed. For patients who have restricted mobility or are unwell, the district nurse will make arrangements to visit your home. If you experience any problem with your wounds, please contact your GP immediately, who will then contact the tissue viability nurse specialist and make arrangements for you to be reviewed in the wound clinic. Dentists. If you've had valve surgery, it is most important that you tell your dentist. If you require any kind of dental treatment, you should expect to receive antibiotic cover. You should also inform them if you're taking warfarin, as this may mean that you need to stop it prior to your treatment, depending upon what that. A guide to the first few weeks at home. Week 1. Exercise is an important part of your recovery, but you should take things easy for your first few days at home. Aim to be as active as you were on your last day in hospital. Remember to carry on with the breathing exercises the physiotherapist taught you. Plan your day to include at least 3 trips upstairs. Walk around the house and garden for 5 minutes. Repeat during the day if you feel well enough. Have a sleep or rest in the afternoon. Accept your limitations and don't overtire yourself. Week 2 onwards, do more activities around the house. Walk for about 10 to 15 minutes once or twice a day. Do not get overtired. Do light gardening, but do not do any digging. You should not lift, push, or pull anything too heavy, as this will put pressure on your breastbone. Shop for light items within a 10 to 15 minutes walking distance. Take short rides in the car as a passenger. You can resume sexual activity if you feel safe doing so. Weeks 4 to 7. At this stage, you should be attending a cardiac rehabilitation class. Many of your activities may be guided by what you are doing in the class. You will probably be able to manage most of the household tasks, but still avoid things such as cleaning windows and heavy gardening. Weeks 8 to 10. Try to be as active as you were before your operation. Take regular exercise and increase the intensity. You should be able to do all the household tasks, but rest in between. You can take longer car trips and travel by plane. You may take up bowling, swimming, or other activities now. If you're unsure, you should check with your cardiac rehab team. Continue to avoid heavy lifting and digging. At the end of 3 months, you should be able to do everything you were doing before your surgery. If you wish to do contact sports, you should consult with your general practitioner first. It is important that you continue with the exercises you were taught in hospital, and do remember it is usual to get aches and pains. The ligaments around your neck, back, chest and shoulders will be stiff. By continuing with the exercises, you will be limiting the useful information. Visiting times. All ward visiting hours are between 2 and 8 p.m. A maximum of 2 visitors per bed is permitted, as patients can tire easily. In consideration of other patients, noise levels within the ward areas should be kept to a minimum. Visitors are asked not to eat or drink whilst on the ward and are not permitted to use patients' toilets. Visitors are asked not to visit during meal times. Visitors are not permitted to bring food, which requires reheating. If your visitors do bring in food, they must inform a member of staff to ensure it is safely stored and labelled. Staff will do their best to be flexible to accommodate your visitors. Critical care unit visiting hours are 2 to 4 p.m. and 6 to 8 p.m. There is strictly a maximum of 2 visitors per bed at any time. No children under the age of 12 are allowed to visit in critical care. Arrangements for children over the age of 12 to visit may be made at the manager's discretion. In certain circumstances, visiting hours can be tailored to meet the needs of individuals, when required upon prior arrangement with the staff. Important: visitors are requested not to visit the hospital if they have any signs of infection, for example, colds, flu, diarrhoea and vomiting. Please contact the intensive care unit staff to make arrangements to visit your relatives in intensive care following their operation. The main hospital switchboard number is 0151 228 1616. Health and safety. It is important to prevent infections when patients are in hospital. By following a couple of requests, you can help matters greatly. Please can all visitors use the specially provided hand gels when entering and leaving the ward. This will help to prevent any infections. Please encourage your doctors and nurses to clean their hands. They will not be offended if you ask them if they clean their hands before attending to your needs. Please do not sit or lie on patients' beds. This is because you are adding to the risk of cross-infection as well as damaging the mattress. Relatives, please do not bring food and drink into the ward for yourself. Flowers are not allowed in the intensive care unit. If your family wish to bring flowers, it is better to wait until you've returned to your ward. Relatives accommodation. The Robert Owen House provides accommodation for the relatives of patients undergoing treatment at the hospital. The house is situated on site. The hotel-style accommodation is built to a very high standard with 17 rooms, a mixture of family, twin and single rooms. A charge is made to the guests for the accommodation, with the costs of maintenance and upkeep being funded through the help of volunteers and charitable fundraising. Please contact Patient Services Department on 0151 600 1041 or 600 1038 for more details. If your relative has any special requirements, for example a ground floor room, please inform staff of this at the time of booking the accommodation. Customer care team. Being a patient, relative or carer can be worrying or confusing time. Sometimes you need to turn to someone for help, advice or support, and the customer care team are here to provide help, advice and support, provide information about the NHS services, listen to your concerns and suggestions, help sort out concerns or complaints quickly on your behalf. If you do have a concern or would like to put some extra support, please ask a member of staff to put you in touch with the team or contact them directly on 0151 600 1517 or 0151 600 1257. Or call to the office based in the outpatient department Monday to Friday between 9 and 5 p.m. and they will be happy to help. Religious beliefs. Whatever your religion, if you wish to have a visit from a minister of your faith, let the nurses know and it will be arranged for you. Your experience. Your experience is very important to us. If you or your family or your carers have concerns before or during your admission, please let us know immediately. Feedback from patients and their carers is valuable to us, as we use your views to help improve the services we provide. During your stay you will be given an inpatient satisfaction survey, the results of which are reported to the Patients' Experience Committee on a regular basis. You will also be given a listening and learning, compliment, comments and concerns leaflet. You can use this to tell us about improvements or what you have felt is good about the service we provided. You have had your surgery to improve your quality of life. We need you to work together with us to help you become a happier, healthier person and would like to wish you every success. Useful telephone numbers. Hospital switchboard number 0151 228 1616. Clinical Nurse Practitioners Helpline 0151 600 1298. Discharge Helpline 0151 600 1056. Customer Care Team 0151 600 1517 or 0151 600 1257. Patient Services Department for Relatives Accommodation 0151 600 1041 or 0151 600 1038. Smoking Advisor 0151 600 1455. If you have any queries regarding your appointment dates, times or admission dates, please contact your consultant secretary. The individual numbers can be found on your appointments letter. Discharge Information Chart. If you find it would be helpful to you to ask the nursing staff or other healthcare professionals, complete this part of your booklet and inform you of what arrangements you have been put in place for your discharge. Please note not all sections will apply to you. The information you will be given includes the consultant's name, date of discharge, physiotherapy advice, dietitian advice, occupational therapy advice, equipment provided, speech and language therapy referral, cardiac rehabilitation referral in place, district nurse referral, social worker referral, follow-up arrangements, referral to anticoagulant, warfarin clinic made, and any other information. Should you require any further information, please visit the following websites on www.lhch.nhs.uk, www.nhsdirect.nhs.uk, www.bhf.org.uk, or www.dipex.org. Alternatively, you can contact the British Heart Foundation information line on 0845 070 807.